Human Health and Human Services and the Veterans Standing Committee to order. We are going to start with the Pledge of Allegiance. And Don, would you be able to lead us in that? Yes.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Seep. And I believe we have proof of notification, correct? Okay. So then I need number 4, approval of our 22-point agenda. All right, motion and a second. All those in favor, please say aye. And can everyone online hear me okay?
Yep.
Okay, great. Thank you. Okay, approval of previous meeting minutes. Hopefully everybody got a chance to look over those. Any corrections or anything? If not, then I'll take a motion for approval. Thank you. Second? Second by Dr. Barris. All those in favor, please say aye.
Aye.
Aye. Any opposed? Yes, Mr. Seep.
Could I have just a second to get focused on my papers here?
Sure. Well, we're at number 6, which is public comment. So we'll give you a minute here. Well, is there anyone from the public who would like to comment? All right, not hearing any. We'll go on to the budget summary. Don, do you need some assistance? Are you okay if we move on to our veterans budget summary? Okay. CVSO knock, I think you're online.
Can you hear me?
Yes.
I'd like to apologize for not being there in public. We've had an exposure to COVID and showing symptoms.
Okay. Well, thank you for joining us online.
If anyone has any questions, I'll be more than happy to answer them.
Perhaps you could just take us briefly through the paperwork.
The funds, the 5550 fund shows some of the expenditures that came out of the general fund. The 55551 shows expenditures that came out of the other funds, soldiers and sailors, and then the expenses for the month, which shows the payouts for the disbursements. If anyone has any questions about any of the numbers.
Were you looking at the first document or the second document in our folder?
Under number 7, the 3 funds. So just on the, if you look on the top of the screen that Barb has pulled up, you'll see fund, 7 fund, 7 fund, 7 fund. And we're on item number 7 on the agenda. So that's why it's labeled like that.
Oh, okay. Now I get it. Thank you. Any questions from anybody on the committee? Is this our year-end budget then for you? Do you have all of your invoices and everything?
Correct.
That was on the last. Under the expenditure, I think is where it's listed, soldier and failure fund. So I guess I do have a question. You probably have explained this before, but the amount that you have left then in your budget, does that roll over then into the next budget year?
No, it goes back into the general fund.
Okay, I couldn't.
Or
I couldn't remember how it worked, if the money that she has left in the budget for veterans, if it goes back into general fund or if it was a rollover budget. But she said it goes back in the general fund.
Yep, what came out of the general fund that was budgeted plus the 3,000 for the needy veterans that is taken out of the taxes from the Richland County residents. Those two things go back into the general fund.
Madam Chair, when you're, I have a couple of questions.
Pertaining to the budget?
Yes.
Okay.
Seth, is the mic on? I'm sorry. Can you hear me now? Yep. Yes. In the past year, apparently you haven't had any requests for assistance from the Aid to Needy Veterans account. Did you hear my question?
Oh, I didn't hear your question. I just heard a statement. Can you repeat your question?
My question was, you have an Aid to Needy Veterans account, which has an ending balance, a beginning and ending balance of $3,000.
Correct.
Did you not have any requests for assistance, obviously?
Still correct.
Okay, now, 2 years ago, you had a donation from an organization in Indiana for $122.50, which went into the Sailors and Soldiers Relief Fund, Soldiers and Sailors Relief Fund. It was designated for a family with children. Have you had any requests or have you dispersed that money?
No, that went back into the general fund also after the year was up.
Spoke so quickly, I didn't understand you. Could you?
Hold on a minute. Oh, everything rolls back into the general fund after the year is up.
So the money is still designated and reserved for a family with children, correct?
I will talk to Jeff in the treasurer's office and then get back to you.
You received a letter along with it requesting that it be dispersed for a family with needy children, did you not?
I believe so. I would have to check the records from that year. 2.5 years ago, I believe.
So there's $2,400 also under the Soldiers and Sailors Relief Fund, not detailed here. That that emanated from the Teddy Roof Fund, a donation for needy veterans. Has any of that money been expended?
That is not under my office budget.
Yes, it's in your budget. It was donated to the Veterans Service Office.
It's donated to the veterans within the county. So that means
The
that
county holds it in the general
if the
fund.
DA wanted to.
Karen, can you speak into the mic just a little bit closer? Maybe we're struggling to understand. I'm sorry.
It was designated for veterans, and of course it's reserved in the general fund until it's called upon.
Don, can I clarify? When are you saying that this money was donated?
The Teddy Roof Fund has been in there for years. And we brought the question up 2 or 3 times in the last 2 or 3 years, and it still apparently has not been dealt with. All we know is that it's in the general fund. It's available to needy veterans. None has been expended from that fund, you're saying.
I would be more than happy to answer the question that you asked. Sure.
Well, you should know whether you spent any money out of it. You recall whether you did?
I have not, because my office is not in charge of that fund. We had clear this up years ago when he came on, and the treasurer's office is also aware of it.
Correct.
If you'd like me to explain, I can do that.
That's incorrect. You better check with the administrator about
Perhaps
that.
we could have Mr. Langrick Do you know of this, or maybe you can clarify?
But we can bring back a report if it is your pleasure on the Teddy Roo Fund and how much of the balance is there.
I think the main question would be, would this be in her purview, or is it under, as she said, the treasurer's office? Because then it would not be applicable to us.
We've been reporting it underneath miscellaneous funds underneath the administration and treasurer's office. It's where it's been housed right now when we're entering into the budget process.
Okay. Does that answer your question, Mr. Sieb?
That's fine. I'm concerned that we have not, given the poverty level in this county, that we have not dispersed any money from the Aid to Needy Veterans Funds in the past several years. I'd like to have a response to that perhaps at the next meeting. Thank you.
Okay, we will make note of that. Thank you. All right, moving on to number 8, our admin report from Ms. Knock.
Yep, so the two reports, those are the annual reports, the final numbers that I just wanted to stick into file folder. And then the other thing that I needed to report on is about 2 days before January 1st, the governor came out with a supplemental grant option. The total number is for our county is $14,228. So I did put together an MOU, memorandum of understanding, and submitted the proper paperwork to the WDVA. It's through the governor is the one that's actually endorsing the supplemental grant. So I have applied for it with the permission of the county administrator after seeing the, thank you, for seeing that.
So that would be the one titled the WDVA Bulletin?
The Bulletin 1100, yeah.
Okay. And then you said you stuck in some numbers. Did you want to go through is that number 8, the copy of calls, walk-in, and copy of forms?
Yeah, we talked about this is the form that I'm going to submit quarterly, but I wanted, and this is the year end of 20.
Okay.
I just wanted to show the completed annual number.
Okay. So on the first one, the copy of calls and walk-ins, I did have a question because it says sheet 1 and then sheet 2. The totals that are on sheet 2, is that the totals for the whole year or just that half of the year that shows?
That's awkward why it's showing up like that. I think when I put it in the file, I submitted it as an Excel, but for some reason it looks like a PDF.
Uh-huh.
The Excel should have had, it has a sheet 1 and a sheet 2. So I think somehow,
Sheet 1, sheet 2. Could you maybe just read for us then what you have for the total number of calls and walk-ins for 2022?
Barb, is that a PDF that's showing on their screen? Is that why there's no second sheet? Because it
They
should have been.
have to be PDFs. You guys can't open Excel docs.
Right. Jamie's pulling it up right now for us to put on the screen, but our internet is a little slow.
It's
Do you
overset.
have it there where you could just read it from your own document?
I do. So the total in walk-ins was the 4,971 and the walk-ins was 1,351.
Okay, and I actually can see that on sheet 2 of my document.
Okay.
So that's good. Okay, so that's calls and walk-ins, and then forms.
Yep.
It looks like you just have the totals per month, correct?
That seems to have fallen off. Yes. I will total them up and then stick them back in the folder for for next month, just so that you can see for review.
All right, thank you. Anyone have any questions, or did you have anything else, Ms. Neff?
No, I just wanted to encourage people, for the month of January, we're doing outreach through WCCU. And we have our traveling trophy and some brochures set up at the main branch of WCCU, being spotlighted as a local business. So just encourage people to stop down and take a look at it.
Madam Chair, there must be something wrong with the mic. It's very difficult to hear.
I'm sorry,
Okay.
I'm not feeling well, and there's a heater running in the background. I'm trying, I promise.
All right, thank you. If there are no further questions, we will move on then. All right, so numbers 9 through 11 are normally our consent items. I did kind of have a question though. Are these like year-end totals now? Or like, are we finishing off the year or will there be another month?
There'll probably be another couple of months.
Couple of months, okay.
Yeah, yeah,
Okay.
definitely. It's just sort of an initial December 2022 picture.
Okay.
So none of the books have closed. So we still have money coming in and invoices coming in. So
All right, well, I did scroll through those. Does anybody have questions on our expenditures reports? That's the vouchers on number 9. It looks like we have a corrected version of it.
yeah,
Maybe the
I
first one.
originally I put in the same one from last month.
Oh.
So the one that's the most recent is the January 12th one. So
Okay.
Yep.
Great. No questions on that. Maybe since we've got a little bit of time, maybe you could talk to us a little bit about the budget.
sure.
We're getting at the end here.
Right, yeah. So obviously we should be at 100% utilization in 12 months. But some of the accounts, obviously, like CCS program, for example, if you go down under behavioral health, CCS programs at 79.1%, that is a program that we run kind of almost 2 months behind on with the way the invoices come in and things like that. Otherwise, if you see a little bit lower utilization, usually it's due to staffing levels. Or what we budgeted for full staffing and what actually happened is the big difference for most of those administrative services. Again, actually, I could speak to all of these if they're a little bit under the 100% because we have some of those delays in things spent kind of at the end of the year. Still paying out invoices. Next month will be a better picture of how close we are to that 100% when we have a true ending to it. Birth to 3, CLTS way at the bottom, those are always a lot higher. CLTS, you can definitely, we can count on getting reimbursed for all of that. So even though that's super over budget, it's all reimbursed. We also have an additional staff person in that unit now. So we're able to take on a lot more children and help them out.
I was actually going to ask that because I felt like, was it last year or the year before that we were really underutilized in the birth to 3, and I think it was because we weren't utilizing that program as much, but maybe I don't remember.
Birth to
that's-
3, I think, has kind of been pretty steady. Yeah, it's the children with disabilities, the CLTS, that's really grown this year. So, yep.
Okay.
Yeah. Public health, obviously with COVID, nutrition looks like we're those expenses in the nutrition program, the meal sites and things are not ramping back up, but are busier, as we've gotten out of having to close sites and things because of COVID. We're a couple years out now, so I think things are looking up in those programs. The same with the transportation, and as you work down children and youth programs, definitely staffing there for a while. CPS contractual services, that's funding that we receive to if we have to TPR children. So there's a lot of legal money in there, and a lot of that wasn't spent in 2022. If we move over to the middle column, it gets a little bit harder on this side because I'm trying to project and anticipate what kind of revenue we still have hanging out there that we haven't received yet. I know the Capital Consortium, we're still waiting on a big chunk of money from them. And then, of course, CCS, there's a delayed revenue there because we're only billing out. We just billed for October, I believe. October, I believe. Yes, we just billed for October. So we still have a couple more months of revenue to come in for that. far as placement funds, we should end up pretty close to almost even on our budget there. Pretty close. I'm trying to think of anything else out there. We did get our WIMCR money, so that was a nice chunk of change. CCS, we got $284,000 from CCS for WIMCR, so that was nice. So that's going to really help our year end. But again, it's going to be at least maybe probably 2 more months before I have some final numbers for you.
Under the placement reports, it looks like we're just through November at this point, correct?
Correct. Yep. Yeah. But projecting out, it looks like we're gonna still be okay. If you look at, oh, I printed the same one twice. Sorry, it's the wrong one. Yeah, if you look at the projection out, we're still gonna be under. And we're in January, so we
Right.
don't have to worry about any unexpected placements.
Okay.
So.
Any questions on budget or placement? Yes, Dr. Barris?
On the revenue side,
Mhm.
if I'm reading this correctly, we projected 7.4 million.
Mhm.
And what it looks like, even with anticipated, we're going to be at 6.5.
No. Just,
We received 5.7 and we're anticipating 817.
yeah, so yes, so 7, yes. And then what we do then is I add tax levy in, the tax levy that was allocated to us.
Okay,
So,
so when you say,
so even though it looks like 6.5, once you add the tax levy in,
so we don't have tax levy anticipated on.
no, I don't have the tax levy anticipated. I add that in up the top.
Okay.
Yeah. And then as far as the chargebacks are concerned, we're working really closely with the clerk's office, so that money is being moved pretty quickly. There's no, like, at the end of the year, I'm going to have to all of a sudden move a bunch of money. They've been really good about when I send over, hey, our payment from the state was lower because of a Winnebago placement cost. They're really good about moving that money from the placement fund into our Fund 56. So that's pretty close to where we're at. There's not a lot out there that hasn't been moved already. So.
Okay, other questions? If not, then under the contract monitoring report, it looked like Angie has that set really nicely. I mean, I feel like it's pretty clear, Angie. The ones that are highlighted are go through November, so we're good. Any questions from anybody on those contracts, or is there anything that you wanted to clarify? No. Okay. Then that'll take us to our action items, which is approving number 12, the HHS contracts, agreements, and amendments. It looks like we've got quite a list here.
Yeah, quite a list. And it starts off with a placement that we had at the end of 2022 called A&J Family Homes and Services. So we'll need approval for that $25,000 contract. And then we'll go on to the 2023. Obviously, A&J carried into 2023 as well, but need that separate approval for the 2022.
Mr. Steve, do I have a second? Okay, thank you. All those in favor, please say aye.
Aye.
Any opposed?
So then we have the next section is 2023. Obviously, like I said, A&J carried into 2023, and they anticipate that to go through the end of the year. So it's relatively high, $285,000. We'll need county board approval. Discovery Play School is the next one. That's just for childcare and respite for children children with disabilities. Family Services of Northeast Wisconsin is a placement that we had in 2022 for a child in residential treatment that'll now be carrying over into 2023. Also, we'll need county board approval since it's $160,000. Hanson Assessment and Educational Services is substance abuse consultation and supervision. And then Pleasant Ridge Homes is another placement that we had, adult family home for behavioral health. Another one that'll need county board approval. It's 150,000. So those will need approved separately. And then there's one that got flipped onto the back page. That's a revenue.
Revenue wouldn't.
It does. We usually do those at the end of the year, like we did them in October. But this is a new one that we've just kind of had this separate agreement that the jail was going to pay us for mental health and crisis services. And we just wanted to clean it up, and we're getting some things down in writing in a contract or MOU, if you will.
So why did it go up?
That, I think, is just projected, is what you guys anticipate, right?
We have an agreement with the jail to provide up to 2 hours per week.
Can you go a little closer to the mic?
All right, we currently have an agreement with the jail to provide services for up to 2 hours per week. So that's how we budgeted the revenue amount.
Okay, thank you. So do those, you said two separate?
Yeah, we'll need just the 2023 brand new contracts and then the revenue separate.
Okay, so first I need a motion for our 2023 contracts. Okay, motion and a second. All those in favor, please say aye.
Aye.
Any opposed? Okay, next we need a motion for our revenue from the jail.
I'll make a motion.
Thank you, Ms. Rudersdorf. And a second? All right, Mr. Braithwaite. All those in favor, please say aye.
Aye.
Any opposed? Okay, that takes us to number 13. Approve the application and acceptance of a state opioid response or SOAR grant.
Good morning.
Hi.
So yes, this is a state opioid response grant. This is a grant that doesn't require any in-kind or match funds. We have a substance abuse counselor that we have hired to work with this grant. And the focus of the grant is working with folks that have opioid use disorders and stimulant use disorders. Any questions?
Have we done this one? We've done this one before, right?
Correct.
Is it always the same amount or has that changed?
It has changed over the years. Sometimes it depends on what our budget is when we present it to them. So kind of we look at what our expenses are and that's what we ask for funds.
Okay,
And they've been pretty good about giving us what we ask for.
okay.
And this is one that technically doesn't need to come to this committee. It can be just approved by Clint because there isn't any match funds. And I guess that would be one question we have. Do you want us to continue to bring these to you or just do it as informational as CVSO NOC did?
Unless other people are opposed, I'm fine with it being informational. I do like that information. I think it's good to know, but if we don't need to approve it, then there's no reason to put it on our action portion, I guess.
Okay, that sounds good.
Does
Thank you.
anyone have any differing thoughts on that? No? Okay, well, if not, thank you.
Thank
for
you.
that. All right, number 14, approve the transfer of funds from Fund 63 Transportation Program to Fund 18 Co-Aging Unit. What does County Aging?
Roxanne and I
What
just.
does CO mean?
Huh?
Is that County Aging Unit? Yeah,
Yes.
okay.
Yes, County Aging Unit. And Roxanne and I just did rock, paper, scissors back there to see who was going to come up here and talk, and I lost, so. Sure. So actually, this is something that's supposed to have been occurring every year. Not really sure what happened, but annually, Roxanne has to do a end of year report for the Department of Transportation, letting them know what funds are left over from the 5310 grant. And then that money's put into a trust fund, which is 8521. I knew I'd get it wrong. See, I knew, flip it, whatever. Anyway, so the 8521, anything that's left over has to go into a trust fund. And then that trust fund is used as a kind of in the background here to for transportation equipment, vehicle repairs, things like that. When we got to looking at the Fund 18 balance. So the end of last year, she reported to the Department of Transportation that our closing balance was $57,522.46 in the trust fund account. When we go look at the cash balance today, it's not. It's only like about $11,443.50. So we need to clean that up for the Department of Transportation, because if they were to ask to see that trust fund balance, we'd only show that $11,000. So it's supposed to happen annually. There has been no fund transfer since I think 2016. Originally, it was done by the auditors. Every year as they complete the audit, they'd move that money. Whatever, it hasn't happened. And I had a conversation, email back and forth with the auditors, and they would like us to do that through the resolution process moving forward, and not through the county audit process. So this is a request to take $46,078.96 from Fund 63, which is where the 8521 money normally sits, and move it into the Fund 18 account so that we can match that report that she does with the DOT. She being Roxanne.
Okay.
And I believe that this is another one of these that does not need to be brought to this committee, that it should go to the administrator.
Okay.
And if you want, as we did with the last one, we just provided as informational to you versus for approval.
Okay.
If you're okay with that.
That's fine with me. And this sounds good. Thank you for the information.
And we'll have to do this do this every year, Clint, because the auditors don't want to do it anymore. So, which is fine. Yeah. Okay. Yeah. Good. Thank you.
Okay. So number 15, review community health needs assessment activities. Was that going to be Rose?
It's going to be Rose, but she just snuck out.
Okay. So maybe we'll come back to that. And I don't know, is Carrie online? I know he had asked for this. So I was hoping he'd, no, okay. All right, so we'll move on to our admin report number 16, and we'll come back to that one.
Right, so we will start with the Economic Support Unit. They are sad to announce the resignation of Savannah Tidrix. Her last day was on January 3rd. She will be missed, and she did get a job at the hospital. She was a great employee. We do have the 2 new workers that have been there for a few months, and they're starting to take phone calls on the call center. They will start by answering phone calls for food share renewals only, and then in a couple of weeks, they will start answering calls on the general queue. They are progressing smoothly through the training process. The Economic Support Unit is in the midst of planning for the ending of the public health emergency. It is slated to end in April, so this means that the first Medicaid renewals will be starting in June. The people with renewals due in June will get their letters telling them this in mid-May, and the first state Medicaid could end for recipients since March of 2020 will be July 1st of 2023. This will be a very trying time for that unit, and they will be very, very busy in the next year. And then the last emergency food share benefits will be issued in the month of February. On January 3rd, the consortium saw one of the highest call volume days since the creation of the consortium, and we do anticipate that this call volume records to be broken once the public health emergency ends. In the ADRC, the original ADRC is officially the ADRC of Eagle Country, serving Richland, Crawford, and Juneau counties. With the change to the 3-county region, there have been no changes to services. Information and assistance staff assist individuals with eligibility and enrollment into the long-term care programs, which includes completing a long-term care functional screen. In order to complete the functional screen, staff are trained and certified in administering the functional screens. Along with this, they have to be recertified every 2 years, and currently they are preparing to take their biannual long-term care functional screen recertification exam in February. The ADRC staff will be providing Dementia Live to law enforcement and jail staff in February, and the ADRC Dementia Care Specialist Program is sponsoring a free movie event at the theater on February 17th and February 18th, featuring Anthony Hopkins in the movie The Father. This will be open to the community, and then after Sunday showing, there will be a community conversation about dementia. In the Children and Youth Services Unit, Hannah Udelhoven applied to attend the forensic interview training, which will allow for the unit to have another staff member trained to conduct forensic interviews on children who have been alleged to have been abused or neglected. Jessica Tisdale will be returning from maternity leave on January 23rd, and we are excited for her return. And Brittany Wirtz completed her probation as of January 11th. In our behavioral health unit, some of the staffing updates. Savannah Ducharme started as our substance abuse counselor in the middle of December. We did offer a position for the CCS case manager for someone, but she declined and took a position closer to home. So we continue to have 2 open CCS positions. Beth Muth will start as a CCS case manager on Monday. And Cindy Bromland, who was a leased employee in the CCS program, will be taking the APS position for the county on the 16th. Corey Knable will also be moving from a lease position to a county position in the CCS program as a mental health case manager. So there are 2 CCS case manager positions open and 1 therapist position. Sherry McGowan was in our behavioral health unit as an RN, and she will be ending on the 31st due to positions being filled. We no longer need her support in that program. Brandy Christensen, who is our treatment court coordinator, started completing IDPs this week, and so those are assessments through the intoxicated driver program. And Savannah Ducharme is also working on that IDP training, so we will have 2 individuals certified to do those. That unit is really working on a lot of policy updates and looking at processes that are happening there and updating as needed. In the public health, as has been the usual scenario since early 2020, staff continue to respond to confirmed and probable cases of COVID-19, engage in limited contact tracing, and are managing outbreaks. The demand for both COVID-19 and influenza vaccines has declined, but the need for both products continue. Surveillance regarding emerging subvariants is ongoing, and whole genomic sequencing completed at the Wisconsin State Laboratory of Hygiene shows that BA5, BQ1.1, BQ1, and XBB1.5 were the predominant strains circulating in Wisconsin as of December 17th in 2020. They continue to work on creating Richland County's Community Health Needs Assessments and its companion document, the Community Health Improvement Plan. In nutrition, we've been fortunate to have several individuals express an interest in serving as home-delivered meal volunteers. And the nutrition program continues to evaluate the impact that the potential closing of the UW-Platteville Richland campus will have on meal preparation activities. We are having a meeting on January 20th with a member of the Education Committee to talk about the program, the campus, the location, and how the closing of the campus will impact the program. And we did visit Crawford County Sustainable Kitchen last week. They started that in January as we are just looking at other options for that program. Couple of things, if you guys get the Wisconsin Counties Association, there was lots of great articles this past month in regards to the mental health crisis in the state and different programs that are happening throughout the state. So it was very, very informative.
Can you move closer to your mic?
Sorry.
Just tip it up a little bit. I think we'll catch you.
All right, there we go. And then there was some discussion last week at the Public Safety Committee meeting about treatment court, and I did have a discussion with the judge earlier this week about the future of the treatment court program. There has been some discussion on should it be housed in HHS or should it be housed in the Register of Deeds offices. So that's just really early conversations, and I will keep you abreast of any changes that may come with that. And then the last announcement that I have is we are sad to announce the retirement of Rose. She has given her notice and will be retiring as of January 30th of this year. She's worked for the county for a total of 12 years. She started out back in 2004 as a public health nurse in the Health, Aging, and Disability Resource Center. And then was a public health resource center nurse. then was a long-term support supervisor in family care until family care was removed from the county and went on their own. She graciously returned to the county in 2016 as a public health nurse, and then has been the local health officer since 2018. Rose has been a wonderful addition to the county, to HHS. She will be missed. You know, her leadership and knowledge and kindness will always be remembered. So I just want to thank Rose for her years of service and let you know that we will miss you.
She possibly retired.
Thank you, Director Clements. Does anybody have any comments or questions for her? Well, Rose, we're going to put you in the hot seat then for number 15, and the discussion, or it says review community health needs assessment activities, if you don't mind. And while you're coming up, I just want to say on behalf of our board, I echo what Director Clements said. We're going to miss you. We want to thank you for your years of service. I think one of the things I appreciate the most about you is how much of your heart you put into your job. I think that it is not just a job for you. That's the way you have approached it, and that is really special. And our community is really going to experience a loss, but we are also very happy for you and hope that you enjoy your retirement.
I'll be getting another job in farming.
What's that?
Because I am 35. I'll probably be seeking some additional employment as well, but but I'll be collecting my retirement too. But
Yes.
and then I'll continue to farm so that I can keep physically healthy. Thank you so much, and it is with immense gratitude that I come to you today to make that announcement, but also to discuss our progress thus far with our community health needs assessment.
Yes, thank you.
As most of our members are aware, completing a community health needs assessment and its companion document, the Community Health Improvement Plan, is a statutorily required expectation of local health departments, and that should occur on an every 5-year basis. We do have options. Our healthcare systems, they are charged with that responsibility every 3 years, and we can join with them and actually complete that process on a more frequent basis if we choose. And it just so happened that this year coincided with our 5-year period of time that has elapsed, as well as the 3-year period of time for our local healthcare institution. So we are combining and working together in many efforts. We were able to secure the services of a consultant, and her name is Dorothy Cheney. She's well regarded with regard to working with healthy communities, and she's worked within the state of Wisconsin for many, many years. And with retaining her services and then working as well with the Richland Hospital and Clinics, we were able to complete a community survey that being quarterbacked by our hospital, and then we were able to hold our consultant completed interviews with key stakeholders or informants from the county that were provided to her. She was given a list of approximately 30 individuals that she interviewed so that they could anonymously discuss their thoughts about the county, about the health department in general, and how we are serving the community, and to identify the most pressing health-related priorities. And those interviews were completed. And then those that could not have that occur in person actually received a survey. And then the community has also engaged in a 2-step process whereby individuals from the community were able to come together at what we call a data walk. One of our nurses, bless her, Carlene Schock, and then I helped a little bit, actually looked at a myriad of different sites where you can get quantitative data on Richland County. For example, our poverty levels, looking at just our demographics, looking at all sorts of information, youth risk behavioral surveys where folks talk about bullying, and they talk about substance use and the like. So we collected a significant amount of quantitative data And then that data was presented to the community for their review and their input. And after our initial data walk, we were able to determine through that process that mental health and substance abuse needs were definitely priorities here in Richland County, and that echoes a lot of what we see throughout the state. And also a quality of life indicator was also indicated as a very important aspect of Richland County. Given that quality of life is a little bit nebulous, we looked at defining it a little bit more specifically. And we looked a lot at the fact that quality of life is very closely tied to health. As far as your physical health is concerned, looking as well at your obesity and nutrition. A lot of quality of life indicators appear to focus on those particular specific categories. But we're also perhaps looking at quality of life as it is impacted by mental health issues and substance abuse. So we're focusing more on substance abuse and mental health because they are much more specific and much more actionable. Whereas with quality of life, it's a little bit more tenuous and a little bit more nebulous and more difficult to try to make some type of significant measurable impact. So that's where we are as far as identifying our needs. A second data walk occurred earlier last month, and Ingrid and some of our individual members here actually participated as well. And during that process, we expanded on those priority areas, and we took a look at how we could begin the process of impacting those, especially if money and capacity were no issues. So we looked at trying to further refine our approach to kind of help, get us set up to begin that process of creating that health needs assessment. And so right now our consultant is beginning that process and with our input, and we'll be meeting here in the next week or so to begin that in earnest. The hospital, they have actually completed their health needs assessment. I don't know if it's posted for public consumption yet, but I have gotten a kind of a preview of that on my own, but I don't know if it's up on their website yet. I don't know, Ingrid, if you're aware of that. I don't know either. Right. And I didn't know if it was just necessarily just a draft or if they were ready to publish that. But we're right in the throes of kind of getting that complete document created, and then that will also be available on our Richland County or Health and Human Services website. And then once we really shake out where we want to go and look at strategies for moving forward, then that will actually begin that process so that we can complete our community health improvement plan. We do need in public health to take a look at some of our key functional public health areas. There are certain things that statutorily we are expected to provide, but also there's certain things that it's nice to have public health do for its community. So we need to look through that lens as we complete these documents as well.
So when is it anticipated that that will be completed?
I am thinking by probably mid to late spring, we should have that document, at least the initial community health needs, or they call it the CHA, many times that document completed, and then the health improvement plan can actually, it'll actually occur after that event. We, fortunately, in public health do not have specific timeframes for these deliverables. A hospital does. They have through IRS, they've got some different dates, but we have a little bit more flexibility in completing those. And I've seen those occur over a 1 or 2 year period of time. So we're actually moving ahead quite quickly in comparison to other years.
Thank you for that report. Can we expect a report once it's done, or be able to actually go over the document?
Yes.
Okay.
Yes,
Awesome.
once it's complete and out of draft form, we'll have it available, and we can actually print it or just have it put on your agendas electronically so that you have the ability to review it.
That would be great. Thank you.
You're very welcome.
Appreciate it.
You're so welcome.
All right. Number 17, discuss the implications to Health and Human Services if centralizing human resources and finance function.
So I guess at this point in time, there really isn't any new information. I guess we are just continuing to plan for it to happen either way. So if it does happen, we're making those arrangements. And if it doesn't happen, we're continuing to talk about how those services will continue to be provided in-house.
Okay, number 18, HHS personnel updates. I know you touched on quite a few of those in your report. Was there anything to add on that?
Yeah, so this just kind of puts everything into one sheet for you. So probably the easiest way to think of this is if you look down at the bottom where it says Southwest Workforce Development, the SWWDB leased staff, or at the bottom, they're basically all, 4 of those are being moved up as transferring from leased employment to county positions that they were qualified for. So as you move those up, really the only new hire we have that's going to be a new face to us is Mackenzie Fisher. So she's a mental health therapist. Everybody's doing this transition on January 16th. So then Danielle Relke will be transitioning from a crisis caseworker in the Richland School District to a mental health therapist. So we'll have our 2 mental health therapist positions filled January 16th. As mentioned, Cindy Bromland was a leased service facilitator working with CCS. She will now be transitioning to Adult Protective Services, also January 16th. And then 2 mental health case managers were internal, Corey Knabel and Beth Muth. And Beth was a secretary at the front desk, so she will be transferring as well. So you'll see her, she's a county employee already though, so you'll see her, why she's in that other category instead is because she is already an existing county employee moving into a new position, internal transfer, so she'll have only 3 months of probationary period where everyone else will have 6. Dennis Drake also will be moving from his leased position, spending that about 5 years, up to an official county position. Then as we continue to go down, there's that the resignations and retirements, Savannah, Tiedrick, and Beth. Rose would have been added to that list, but we just got notice this morning kind of, so I will make sure to update this and add her to the list as well. And then under lease staffed then also will be added is Sherry McGowan, who is a part-time psychiatric nurse that will also be finishing up the end of this month. So down at the bottom, then you'll see all the different vacant county positions that we have. Of course, we'll be adding public health nurse, manager, and local health officer to that list as well, and we'll be advertising, which at this point, we're only advertising for the mental health case manager vacancy as well. So we'll have those 2 out there within the next week or so, I would think. Any questions on all the movement?
I think you explained it well. I don't have any questions. Does anyone else?
I will be bringing the org chart updated in March as well. So then you'll see, we'll give February, it's that quarterly response. I just did it in December. So then we'll do it again in March and you can see what things look like visually as well.
Good, thank you.
Mhm.
All right, number 19 is our closed session. And then after we're done with that, it looks like we're pretty much at the end of the meeting. So for those of you who are leaving now, thank you for coming and bearing with us. And then for closed session, we probably need to have somebody like take at least minutes of who does the motions. What's that? Yeah, like I think we have to have the motion of when we go out and then when we come back in. Yes. Oh, you got it? Thank you, Mr. Langre. All right, so I do need a motion. Thank you, Mr. Renish. I need a second for the motion to go into closed session. All right. All those in favor? Aye.
Need to know who online.
And any opposed? Okay. We will need just looks like Danielle and Sherry. I think she moves them into a breakout.
Yeah, we go to a breakout. No, you'll just go to a breakout. Yeah, Danielle and Sherry.
What? It was, I don't know, but both of you, yeah,